Hi guys, so today we're going to be talking about borderline personality disorder. You might be wondering, what is this? How does it look like? Let's dig in, let's figure it out. So this disorder is a brain disorder and it is marked by impulsivity and emotional dysregulation. And it has its main neurotransmitter that is involved is serotonin. So this serotonin has an effect on various different parts of the brain. So we're going to take a look at that right now. The first disruption is found in the prefrontal cortex, and normally this brain helps us regulate emotions and keeps us from inappropriate actions. But in the patient with BPD, this part of the brain doesn't respond, and it causes an extreme intensity of negative emotions. So instead of those emotions being regulated, they just maintain at a negative state. The second disruption is found in the limbic system, or the amygdala, and in a patient with BPD, this emotional center of the brain is overstimulated, and it takes longer than normal to return to its original state. So it gets really, really high, and instead of decreasing at a normal rate, it is maintained at that overstimulated state. There also may be neurotransmitters, like we talked about, serotonin, that are underfunctioning in the patient with BPD that can cause prolonged fight or flight response. So instead of this response going away after a while, it is once again maintained at a really high level. And this contributes to those really impulsive, aggressive, negative emotions that we see in these kind of patients. So borderline personality disorder is most common in people who have relatives with the same disorder. And lots of times these relatives, one, either will have borderline personality disorder or will have traits like hypersensitivity, impulsivity, and emotional dysregulation that all kind of play a role in the development of BPD. So we're going to talk about a woman named Margaret Mailer, and she was a psychologist who sought to learn more about BPD in children. And so she wanted to know what caused it, what kind of psychological issues put these kids at risk for the development of this disorder. So she talked about the whole idea of separation. She uses an example about a mom or a parent sitting at a bench in a park, and there's a a sandbox that's kind of far away. And so this mom should normally have developed a sense of security with her child and a place of safety for their child to kind of remain in, but she also should encourage exploration, and she should push her child to kind of be autonomous. And so her example is that the mom will push the child to go look at the sandbox and figure it out and kind of play around, but then the mom will welcome the child back, and the child will feel comfortable coming back to the mom knowing that it's safe and it's secure. But in a child that might develop borderline personality disorder, this process is interrupted. So it can go one of two ways. Either the child goes out, they're encouraged by their parent to go out into the sandbox to look at it, but then when the child looks back at the parent, they're on their phone or they're not paying attention. And so the child then doesn't feel like they have a safe and secure foundation to come back to in their parent, which causes all these kinds of separation disruptions. So the second way that this could go is that the mother would not encourage her child to go explore. She would not encourage that separation, most likely because she has her own abandonment issues and she has other personal psychological issues going on. And so instead of fostering safety and security and the cultivation of exploration, she instead just kind of keeps her kid to herself and doesn't allow them to explore as they need to. So that's kind of a couple of the factors that play into borderline personality disorder, and also a little bit of the causes in the brain.
Hey guys, this is Jessica, and I'm going to be talking about the signs and symptoms, what to watch for in the diagnosis and screenings of personality disorders. So personality disorders are grouped into 3 different clusters of similar behavior patterns and personality traits, and borderline personality disorder is in cluster B, which is the group with behaviors that are described as dramatic, emotional, or erratic. Borderline personality disorder is the most well-known and dramatic out of all of the personality disorders, and these people experience severe impairments in functioning. The major signs and symptoms of the disorder are emotional lability, impulsivity, identity or self-image distortions, unstable mood, unstable interpersonal relationships, and they often have patterns of marked instability relating to emotional control or regulation. It is also characterized by feelings of antagonism that are manifested in hostility, anger, and irritability in relationships. As with many other disorders we've discussed, safety is always a top priority. Self-destructive behaviors are very prominent in this disorder, and because of this, it is important to watch for these so that we are always keeping the patient safe. These self-destructive behaviors are often harmful self-soothing habits such as cutting, promiscuous sexual behavior, and numbing themselves with substances. So chronic suicidal ideation is also a common feature of this disorder, so it's important to watch for any signs of impending suicide. And because of the sudden and extreme mood shifts seen with this disorder, it is obviously important to watch for the safety of the patient, but it's also important to watch for the safety of those people around them. So physical violence towards partners can occur, and violence is also commonly manifested through property damage. And one unusual feature of this disorder that should also be watched for is called splitting. So splitting is a defense mechanism or a coping style that refers to the inability to view both positive and negative aspects of others as part of a whole. So this means that they could view someone as either a wonderful person or an absolutely horrible person. And then for screenings and diagnoses, so when a patient is screened for borderline personality disorder, the preferred method for determining a diagnosis is a semi-structured interview by a clinician. And the most well-known screening test is called the Minnesota Multiphasic Personality Inventory, which is useful because it has built-in validity and reliability skills for the clinician to use when interpreting the results. On the questionnaires and rating scales, many things are assessed, such as feelings of emptiness, intense and unstable romantic relationships, risky behavior analysis, a tendency toward anger, sarcasm, or bitterness, and any suicidal or self-harming behaviors. It is also important to include a history of suicidal or aggressive ideation or actions, treatment history, and medication use in the diagnostic assessment for this disorder. The most common nursing diagnosis associated with this disorder is self-mutilation, which is defined as deliberate self-injury behavior causing tissue damage with the intent of causing non-fatal injury to attain relief of tension.
Hey, so this is Molly, and I'm going to be discussing the nurse's role in caring for a patient with borderline personality disorder, as well as some of the treatments. So like Jessica discussed, these patients often present with a variety of psychological struggles, such as impulsivity, suicidal thoughts, anxiety, depression, things like that. So it's the nurse's role to determine which of these struggles is the most important to deal with. Often the main priority is patient safety, so it's important as a nurse to implement these proper safety precautions. The care plan for these patients is established based on the perspective that personality changes occur one behavioral solution at a time and one learned skill at a time. These patients are not going to change overnight, and we can only focus on changing one thing at a time. As a nurse, it's important to remember this and to be able to have patience for these patients. Our book discusses the need to assess ourselves as the nurses and to determine any underlying issues that we may have. It reports that many nurses have difficulty dealing equally with patients with BPD and find them very challenging to work with. It suggests that staff have a time to vent their feelings weekly about these patients or about even other peers, and just have a time in a safe environment to share their feelings. Going along with this, a therapeutic relationship is very important in these patients. Most of these patients have experienced failed relationships in the past, and it's important that they are able to have a person that they can trust and share their feelings with. Nurses need to be able to provide clear and consistent boundaries and limits and use very straightforward communication with these patients. As they can often be impulsive and manipulative, it's important that they have these boundaries and know that they cannot cross them without a consequence. There are currently no known drugs used specifically for BPD. However, many people are prescribed drugs for symptom relief and to help specific parts of BPD. For example, people are often prescribed SSRIs to treat their depression, or lithium for their mood and emotional dysregulation. Often, naltrexone is prescribed for their self-interest behaviors. Some advanced practice treatments that have proved successful are cognitive behavioral therapy to help identify inaccurate core self-perceptions. There's also dialectical behavioral therapy, which combines the CBT with mindfulness to help the patient be acutely aware of their thoughts and actively shaping them. There's also schema-focused therapy, which combines CBT with other forms of therapy that focus on ways that individuals view themselves. This therapy is based on the belief that BPD is the result of dysfunctional self-image, probably brought about by a dysfunctional childhood. So the main overarching nursing goal for these patients is safety and stabilization. These patients have a long road ahead of them, and it's not going to change overnight. And it's important that the nurse can recognize this and can deal in a compassionate manner with these patients to help them change one thing at a time.